Attending is the physical and psychological stance that helpers take toward their clients to demonstrate interest and respect and to receive information that is communicated to them by their clients. In essence, attending means paying attention. Controlling your focus can sometimes be difficult. We're all open to outside distractions, and our internal thought process can also be distracting at times. We can momentarily lose our concentration and focus, or drift off for a period of time, and not truly be paying attention to what the client is saying. Attending requires that a counselor's physical and psychological attention is directed at the client for the whole duration of the counseling session. This takes self-awareness and practice over a period of time. The good thing about attending skills, nonverbal and verbal skills, listening skills, all of these types of foundational micro-counseling skills can be practiced every day in your life with your friends, family, classmates, coworkers. We can all be better at directing our focus, concentrating in whenever we're communicating with another person. We can also be better at paying attention to someone's body language as they're trying to communicate with us, to pick up mixed signals, and to just be a more attentive listener. In order to build a firm foundation in a supportive or caring counselor-client relationship, strong attending skills must be in place. These skills help us to be in attendance in the present moment and have complete focus on what the client is saying. If we fail to engage in strong attending behaviors, we may be giving the signal to the client that they are not being fully supported or that what they're saying is uninteresting. This can possibly create a disconnect with the client and inhibit them from making progress. Attending doesn't mean just paying attention to what the client is saying and giving them the message that we're listening, but it also means paying attention to our own body language, the signs that we're giving off, as well as the client's body language. We also take into consideration the silences and pauses in the conversation. To begin the attending process, we have to start with a warm welcome to the client. The therapeutic relationship starts as soon as we meet the client. It doesn't just start as soon as we really dive into the client's issues. If you're at a place where you have to go out and get the client from a waiting room, it starts from the first time that you lay eyes on each other and you introduce yourself. You take them back to the therapy room. All of this is part of the process. You have to be warm and welcoming and open. We have to make people feel comfortable from the onset in the counseling environment. It makes them feel more relaxed about disclosing personal information, emotions, feelings, and thoughts. Attending shows respect, and it builds trust, which is the foundation of the therapeutic relationship. It conveys interest, helps our clients feel comfortable, and we provide an environment that is warm and engaging, where clients feel like they are truly supported and what they're saying is meaningful. Here are some key points to attending. Face the other person squarely, sending the message that I'm with you. This conveys empathy and openness. An open posture helps to facilitate this even further. Non-threatening and supportive body language gives the client the understanding that we are not there to hurt them, we are not there to judge them. We are there to listen and be supportive. Leaning forward in moments when appropriate shows interest or concern. At first, leaning forward might not be the right attending behavior to use because someone may not be comfortable yet, and so leaning forward might seem threatening. So every little movement in our body and our body language sends a message. I like to lean forward whenever someone is expressing something that is difficult, or maybe they are getting emotional, and leaning forward shows that we're really in it with them, and we're there with them in that emotion. Making eye contact is a fundamental part of attending behavior, depending on a client's culture and if eye contact is seen as respectful, as it is in the American culture. But eye contact, all of these attending behaviors need to be assessed in terms of having a cultural component too. We need to make sure that it lines up with our client's cultural views. And be relaxed. Clients will feel uncomfortable if we show that we are anxious. So some types of attending behavior are eye contact, our facial expressions, our body language, a comfortable physical distance. Too close is invading someone's personal space, and too far apart shows that we're not attached, we're not close and involved and invested. You don't ever want to have to shout across a room or across a table. You shouldn't have anything in between you and the client, a table or desk. It's best to have 2 chairs that are of the same height and a comfortable distance apart. Body language includes sitting with an open, comfortable posture, facing the client, not having our arms crossed, because that tends to be a closed posture. Our vocal qualities are the manner in which statements are made. What is the volume and the rate of speech? We don't want to be too loud and talk over the client or sound demanding or abrasive. We want to have fairly soft speech of a normal rate. And verbal tracking is both nonverbal and verbal. It's letting the client know that you're following. So it's shaking your head, nodding your head in agreement of what they're saying. Or you can use verbal trackers such as These are all types of attending behavior that lets the client know that we are invested in what they have to say, that we are supportive and open, and that we care.